Hello, everyone. I'm Dr. Christina Marie, a board certified developmental optometrist. I specialize in evaluating how the eyes work together and how the brain interprets and integrates visual information. My focus is on helping patients, especially children, overcome challenges related to vision that impact their learning, attention, and daily life. Through my work, I aim to bridge the gap between vision and overall development, ensuring that every child has the visual skills necessary to thrive academically and socially. Today, I'm excited to share insights on how vision plays a crucial role in learning and development. Let's get started. Many parents come to us after noticing concerns themselves, while others are referred by a physician, therapist, or teacher who suspects a vision challenge. We often see children with headaches, eye strain, or complaints of blurry or double vision. If your child has already been diagnosed with a vision issue by an optometrist or ophthalmologist, we'll take a more comprehensive look at how their visual system is functioning. We also frequently receive referrals for children struggling with reading, such as skipping words, losing their place, or avoiding books. Similarly, when children have difficulty with attention and focus during near work, or struggle with writing, hand-eye coordination, or frequent letter reversals, we assess whether these challenges could be related to their vision. Additionally, many referrals come from concerns about spatial awareness, such as clumsiness, poor sports performance, or difficulty judging space. In this video, we won't spend too much time discussing overall development. Instead, we'll focus on the visual system and visual processing, how the eyes and brain work together to interpret and respond to visual information. If you're interested in learning more about how the visual system develops and why visual challenges emerge, we have an additional video that dives deeper into that topic. Let's start by learning how our eyes work. When we talk about vision, it's important to understand that vision is more than just eyesight. Eyesight refers to how clearly we can see, often measured as 20/20 vision. It's the ability to see small details at a distance. Many vision screenings only test for this, but passing a 20/20 test doesn't mean a child has good overall vision. They may still need glasses or have other visual challenges not detected in a basic screening. Vision, on the other hand, is much more than clarity. It's how the brain processes and interprets what the eyes see. Vision allows us to make sense of what we're looking at by connecting it to past experiences and integrating it with our other senses. In short, eyesight is just one part of vision. True vision is the eyes and brain working together. That's why a child can have perfect eyesight but still struggle with reading, attention, or coordination. Now, let's talk about how our eyes work. For most people, vision is effortless. We don't think about our eyes because they should always provide a clear, single image without strain. But when there's a problem with eye coordination or focus, it can become a constant challenge. Our eyes must work together in perfect alignment and coordination to focus properly. This is especially important when switching between looking at something in the distance, like a whiteboard, and something up close, like a book or worksheet. Looking in the distance is naturally relaxing for the eyes. The muscles that control focus and alignment are at rest, making it easier to maintain clear vision. On the other hand, looking up close requires more effort. The eyes have to turn in, focus precisely, and sustain that effort for extended periods. This creates visual stress, which can lead to fatigue, strain, or difficulty keeping up with near work like reading and writing. If a child struggles with these functions, they may experience discomfort, avoidance, or difficulty keeping up in the classroom. During the evaluation, we'll assess how well their eyes coordinate and handle these visual demands. When our eyes don't align on the same point, each eye sees a separate image. The brain then struggles to merge these images into a single, clear picture. Both eyes must focus on the same point in space to see a clear image. The eyes can only focus on one distance in space at a time. Just like a camera lens that can't keep both the foreground and background sharp simultaneously, our eyes must constantly adjust focus between the board and our notes to see each one clearly. Functional binocular vision requires precise eye alignment and focusing to maintain clear, comfortable, and sustained vision. Binocular vision disorder occurs when the eyes do not work together properly, causing mismatches in alignment and focus. This can lead to symptoms like double vision, blurred vision, and visual discomfort. In the early years, such as kindergarten and first grade, reading materials are designed to be visually accessible. Fonts are larger, spacing between words is wider, and children are encouraged to use their fingers to guide their reading. Teachers also incorporate frequent breaks with movement and hands-on activities, reducing the strain on a child's visual system. Because reading sessions are shorter and less demanding, subtle vision issues may go unnoticed. However, the demands on a child's visual system increase significantly in second and third grade. Font sizes in books and worksheets become smaller, requiring more precise eye movements to track words accurately. Words become more complex, with fewer picture cues to support comprehension. The amount of text on a single page grows, and working periods extend with fewer breaks. Although a child may have performed well in earlier grades, this shift in visual and cognitive demands can suddenly reveal underlying vision weaknesses, leading to a decline in academic performance and confidence. When does a person become symptomatic? At first, many children compensate for visual challenges. Their brain works harder to overcome difficulties with eye coordination or focus. However, this increased effort comes at a cost, often leading to fatigue, headaches, and reduced stamina by the end of the day. When compensation is no longer enough, children may begin to avoid visually demanding tasks. They might avoid reading, close work, or anything that requires sustained focus. Instead, they may prefer listening over reading, lose interest in school, or appear inattentive not because they don't want to learn, but because the effort required is too great. Finally, when visual stress exceeds their ability to compensate, they become symptomatic. This is when signs like blurry vision, double vision, eye strain, difficulty tracking, skipping words, poor comprehension, and frustration with near tasks become noticeable. In some cases, prolonged stress on the visual system may even lead to strabismus, eye misalignment. Exophoria is a condition where the eyes naturally drift outward when they are not actively working to stay aligned on a target. This means that while both eyes may appear straight when the brain is focusing on keeping them aligned, we can observe this using a simple cover test. When both eyes are open, they work together to maintain focus. However, when we cover one eye, the uncovered eye remains focused on the target while the covered eye relaxes into its natural resting position, which in the case of exophoria is slightly outward. When we quickly uncover the eye, we can see it move inward as it realigns with the target. This movement confirms the presence of exophoria.
Here's a real life example of a cover test. With our patient here, when we cover the eye, you can see that the eye is drifting off. As soon as we uncover, the eye refixates onto the target. So watch the eye that we covered up and watch how as we flip the paddle from one eye to the other, the eyes drift back to the center.
Esophoria is a condition where the eyes naturally drift inward when they are not actively working to stay aligned on a target. This means that while both eyes may appear straight when the brain is focusing on keeping them aligned, one eye tends to rest slightly in front of the target when not actively engaged. When both eyes are open, they work together to maintain focus. However, when we cover one eye, the uncovered eye remains focused on the target, while the covered eye relaxes into its natural resting position, which in the case of esophoria is slightly inward. When we quickly uncover the eye, we can see it move outward as it realigns with the target. This movement confirms the presence of esophoria. The Worth 4-dot test is a simple and effective way to assess how both eyes are working together and whether a person is experiencing double vision or suppression. During this test, the patient wears red-green glasses, which separate what each eye sees. One eye can only see the red lights, while the other can only see the green lights. When looking at the Worth 4-dot pattern, what the patient reports seeing provides valuable insight into their binocular vision function. If both eyes are working together normally, they will see four dots, two green, one red, and one yellowish dot where red and green overlap. If the patient sees only red or green dots, it means the brain is suppressing input from one eye. If they report five dots, it suggests double vision, meaning the eyes are not aligning properly and the brain is receiving two separate images. The binocular cross-cylinder BCC test is used to evaluate how well a person's eyes work together to focus on near objects. It helps determine if there is a problem with the eye's ability to maintain clear and comfortable vision when reading or doing other close-up tasks. During the test, the patient looks at a grid of lines through a special lens system. We introduce different lens powers to see if the horizontal or vertical lines appear clearer. This allows us to assess how the eyes focus and whether they are overworking or underworking to maintain clarity. Kids only know how they see, they assume it's normal. Children don't compare their vision to others and assume everyone experiences the world the same way they do. If reading is exhausting for them, they might not realize it's a vision problem and instead think reading is just hard. If they see double, they may not describe it that way. Instead, they might start avoiding reading altogether. If their eyes don't work well together, they may struggle to focus or sit still, which can be mistaken for inattention or a lack of effort. Rather than saying, I see double, children often express their struggles in other ways, such as, I hate reading, my head hurts, I don't like school, or I can't focus. A child's eye may turn for several reasons. Genetics and family history play a significant role, as strabismus can run in families, increasing the likelihood of an eye turn. Uncorrected vision problems, such as significant differences in prescription between the eyes or untreated refractive errors, can make it difficult for the brain to merge images from both eyes, leading to misalignment. Poor binocular development can also contribute, as the ability to coordinate both eyes for depth perception and focus requires proper neurological and visual maturation. Strabismus often occurs as a sensory adaptation to avoid visual confusion. Amblyopia and suppression are often confused, but they are actually two different visual conditions. Amblyopia, also known as lazy eye, occurs when the brain favors one eye over the other, leading to reduced visual acuity in the weaker eye. The brain naturally wants to use the least amount of energy, so if one eye isn't providing a clear image, it gradually relies less on that eye, resulting in both reduced clarity and suppression. Suppression, on the other hand, happens when the brain actively turns off or ignores vision from one eye to avoid confusion, such as double vision. Unlike amblyopia, suppression does not necessarily mean reduced acuity. Visual clarity may be normal, but the brain has adapted by ignoring one eye's input to compensate for misalignment or other binocular vision issues. Both amblyopia and suppression can impact depth perception, reading, and daily visual function, but they require different approaches for treatment. Identifying whether a child has amblyopia, suppression, or both is an important step in determining the best intervention. When a child has a binocular vision dysfunction, they often develop ways to cope with the challenge. Some children work hard to keep both eyes aligned and functioning together, putting in extra effort to maintain clear and single vision. Other children compensate or avoid in different ways. They may tilt their head or close one eye to reduce double vision. Some develop suppression, where the brain ignores input from one eye to eliminate visual confusion. In more severe cases, strabismus, an eye turn, may develop as the brain struggles to maintain alignment. Many children also start avoiding reading or near work altogether because it becomes too uncomfortable or difficult to sustain. This chart helps illustrate how different levels of visual stress and stamina impact a child's ability to function in daily tasks, especially when reading or focusing on schoolwork. In the low stress, good stamina quadrant, vision is comfortable and effortless. These children experience sustained focus, work efficiently, and feel confident in their visual abilities. This represents normal binocular vision, where the eyes work together without strain. In the high stress, high stamina quadrant, children are compensating for an underlying visual issue. They may appear to be doing fine, but are often symptomatic, struggling to keep focus over time, and may experience breakdowns due to the extra effort required to maintain visual function. This group pushes through their difficulties, but at a cost. In the low stress, low stamina quadrant, children do not experience high visual stress, but their stamina is low. They may seem easily distracted, require frequent breaks, or have a slow work pace. This pattern is often seen in children with amblyopia or strabismus, where they no longer use two eyes together at the same time. Finally, in the high stress, low stamina quadrant, children experience significant symptoms and struggle to sustain effort. They may have difficulty keeping focus, increased frustration, or avoidance of visual tasks altogether. This is where we often see behavioral manifestations of vision problems, where a child may act out, resist schoolwork, or be incorrectly labeled as unmotivated or inattentive. When treating strabismus, two main approaches exist: surgery and vision therapy. Surgery primarily corrects the cosmetic alignment of the eyes by adjusting the eye muscles, but it does not retrain the brain to use both eyes together, which is essential for proper binocular vision. Studies show 30 to 50% of patients need multiple surgeries, and many still experience double vision or suppression since the brain E connection remains unaddressed. Vision therapy, however, trains the brain to control eye coordination and improve depth perception. Research shows a 75 to 90% success rate, and in our office, we are proud to say that we see success in around 90% of our patients at any age who fully commit to their prescribed program. Beyond alignment, vision therapy enhances essential visual skills for reading, learning, and daily activities by teaching the brain to integrate both eyes' input. While surgery may improve appearance, vision therapy develops functional vision for lasting performance and quality of life. When it comes to treating amblyopia, there are two primary approaches: patching and vision therapy. Patching works by covering the stronger eye to force the weaker eye to work. While this can improve visual acuity, it does not train both eyes to work together, which is essential for depth perception and long term visual function. Many children who undergo patching still struggle with eye teaming issues, making it difficult to track, focus, and sustain visual attention. Additionally, studies show that amblyopia can return if treatment stops without addressing binocular vision, leading to high recurrence rates. Vision therapy, on the other hand, targets the brain's ability to use both eyes together, improving depth perception, tracking, and overall visual function. Unlike patching, vision therapy is effective at any age, though younger patients tend to respond more quickly. Research shows that binocular training can significantly improve not only clarity, but also reading speed, learning, and visual efficiency in daily activities. By treating amblyopia as a binocular problem, vision therapy offers a more comprehensive and long lasting solution. The next step in visual development is ocular motor control. Ocular motor control refers to how well the eyes move and track together, giving us insight into how effectively they work as a team. Strong ocular motor control depends on a well developed binocular vision system, meaning both eyes must align and communicate properly with the brain. Ocular motor control develops in stages as a child's brain learns to coordinate eye movements with precision. In the first few months of life, vision is poor and eye movements are uncoordinated, making it difficult for infants to direct their gaze. By ages 2 to 3, children begin following objects smoothly with their eyes without needing to touch or move their body, showing increasing control over eye movements. By ages 4 to 5, smooth and controlled eye movements should be well developed, allowing for efficient visual tracking, reading, and coordination. Ocular motor control relies on stable eye teaming and focusing, as the brain must send precise signals to the eye muscles to ensure accurate movement. If this system is not functioning properly, children may struggle with tracking words across a page, maintaining focus, or coordinating their eyes for learning tasks. Central vision, controlled by the fovea, is responsible for focusing on individual words, decoding letters, and understanding meaning. It allows us to fixate on one word at a time before moving to the next. Peripheral vision, on the other hand, plays a crucial role in guiding eye movements and anticipating upcoming text. It helps us see words ahead while still focusing on the current word, allowing for smooth reading flow. Peripheral vision also aids in controlling saccades, quick eye movements that allow us to jump efficiently from one word to another, preventing us from losing our place while reading. When both central and peripheral vision work together effectively, reading becomes fluid, effortless, and efficient. Here's an example of good tracking skills in a second grader. In the office, we use software that allows us to track the movements the eyes make while reading across a line or a paragraph of text. In this example, the child demonstrates smooth left to right eye movements. Each green circle represents a stopping point, and ideally, a second grader should stop 2 to 3 times per word to process it properly. Most children do not recognize every word instantly, so multiple fixation points help with word recognition. As the child moves across the text, we see a smooth return sweep at the end of each line, indicated by the blue line transitioning from the previous line to the next. The occasional jumps from the top to the bottom of the paragraph are common when children check how much they have read. Overall, this tracking pattern shows strong left to right movement, a steady reading speed, and a natural cadence. There are a few instances where the child goes back to reread, but overall, this is a great example of efficient eye tracking during reading. Here's an example of a different second grader with not so great tracking skills. As we can see here, we can tell that the child is trying to read from that left to right trajectory. We do have some return sweeps where they're able to jump down to the subsequent line, but overall, there's a lot of going back. They're not catching every word, and even though they may feel like they read the entire passage, many parts were skipped. In this next example, the child is using their eyes to guide themselves not only to the end of the line, but also back to the beginning of the next one with excessive movements. This child is making significantly more eye movements compared to the previous example, indicating weaker tracking skills. While they are still hitting most of the words, the process requires much more effort and visual work. The increased motion and movement suggest that their eyes are not efficiently guiding them through the text, leading to extra fixations and regressions. When tracking skills are not strong, the eyes struggle to find the next words smoothly, resulting in many small, unnecessary movements that make reading more difficult and effortful. Here's an example of a child who is reading too quickly with very few fixation points. Instead of making the necessary stops to process each word, they are rushing through the text, often skipping over words. Their eye movements show large jumps between words, indicating that they are more focused on getting through the passage rather than truly reading and comprehending the content. While they may appear to be reading fluently, their comprehension is likely to be poor since they are not giving their brain enough time to process the meaning of the words. After age 5, the brain shifts to developing higher level visual processing, which supports reading, writing, and learning. Since 80% of classroom learning relies on vision, strong visual perception, memory, and motor integration help children process information efficiently. However, if foundational visual skills are not automatic, the brain must still devote energy to them, making it harder to develop these higher level skills and keep up with schoolwork. Visual processing testing helps us understand how different visual skills work together and where gaps in development may be creating learning challenges. Visual skills build on each other, meaning that weaknesses in one area can affect overall performance. Testing allows us to pinpoint where skills are breaking down. Some children compensate by excelling in certain areas to make up for weaknesses in others, while others avoid visually demanding tasks altogether, causing deficits across multiple visual skills. Identifying these patterns helps us create targeted interventions to strengthen visual processing. Visual perceptual skills are essential for reading, writing, and overall academic success. Visual discrimination allows a child to recognize differences between similar looking words like look versus lock. Visual memory helps with sight word recognition, allowing quick recall of frequently seen words. Visual spatial skills support distinguishing between similar looking letters or words like big versus dig. Visual form constancy enables reading in different fonts and sizes without confusion. Visual sequential skills are necessary for spelling and organizing information in the correct order. Visual figure ground processing helps a child focus on relevant text and avoid getting lost in a busy paragraph. Finally, visual closure allows us to recognize words without looking at every letter, enabling faster reading speeds and improved fluency. Handwriting is a complex skill that depends on multiple visual and motor systems working together. Tracking and visual efficiency allows smooth eye movements to maintain alignment, spacing, and transitions between lines. Visual perception helps recognize shapes, letters, and spacing for consistent letter formation. Visual motor integration ensures coordination between the eyes and hands for precise writing. Visual memory aids in recalling letter shapes and patterns for fluency. Spatial awareness maintains even spacing, alignment, and organization on the page. Fine motor coordination enables controlled pen movements guided by visual input. Finally, a feedback loop allows for self-correction and refinement, improving neatness and efficiency. When these systems function well together, handwriting becomes more automatic, reducing frustration and allowing children to focus on the content of their writing rather than the act of forming letters. Vision therapy can significantly improve handwriting without directly working on fine motor skills. On the left, the child's handwriting before therapy shows large, inconsistent letters, poor spacing, and difficulty staying on the lines. Signs of visual processing challenges. Frequent erasures suggest difficulty tracking while copying, making writing slow and effortful. After just a few months of vision therapy, the handwriting on the right is smaller, more uniform, and well spaced, with fewer errors and better alignment. These improvements are not due to changes in pencil grip or finger strength, but rather enhanced eye tracking, visual spatial awareness, and processing. When a child struggles to track their place, maintain spacing, or align letters, handwriting becomes disorganized and exhausting. Strengthening the visual system allows for smoother, more efficient writing, reducing frustration and boosting confidence. The real benefit is not just neater handwriting, but making writing easier and more automatic, allowing the child to focus on learning. Our brain processes information in different ways, but one of the most powerful tools we have is our ability to remember pictures. Visual memory plays a crucial role in learning, reading, and comprehension, and when combined with auditory input, it significantly improves recall. Studies show that when we hear information alone, we tend to remember only about 10% of it after 3 days. However, when that same information is paired with a visual component, our retention jumps to 65%. This is why visual learning is so effective and why children who struggle with visual memory may find it harder to recall words, spelling patterns, or instructions. Our brain sees words as a collection of tiny pictures, recognizing familiar patterns and shapes rather than just individual letters. To read fluently, we must quickly identify the distinct features of letters and words. Children with weak visual memory may struggle to recognize sight words, recall spelling patterns, or distinguish between similar looking words, making reading much more effortful. Understanding the connection between visual processing and learning can help us better support children who face reading challenges. The most effective learning happens when vision, auditory processing, and tactile input work together seamlessly. When a teacher presents information, students learn best by hearing the words, auditory, seeing the material, vision, and engaging in writing or hands on activities, tactile. This multisensory approach strengthens understanding, retention, and comprehension. However, if one of these systems is inefficient, it can disrupt learning rather than support it. For example, if a child struggles with visual tracking, their eyes may not move smoothly across the page, making it difficult to copy from the board or follow along while writing. Instead of absorbing the lesson, they spend energy searching for their place, reorienting their eyes, and keeping their letters aligned. Writing becomes so demanding that comprehension suffers, leading to frustration and academic struggles. When visual skills support learning rather than compete for attention, children can absorb, retain, and apply information more effectively, leading to better comprehension, confidence, and academic success. The top two sections of the pyramid, academics and executive functioning, represent the challenges that parents, teachers, and caregivers notice. Struggles with reading, math, comprehension, attention, and organization are the visible signs that something isn't working efficiently. However, these skills rely on deeper foundational systems that are not as easily observed. Attention challenges can stem from multiple factors, and vision problems are often overlooked as a contributing cause. When the eyes struggle to work together, it can make reading and near work exhausting, leading to difficulty sustaining attention, fidgeting, restlessness, and avoidance of tasks that require prolonged focus. A child may appear inattentive when, in reality, they are experiencing visual discomfort that makes it hard to stay engaged. This can result in slow or inconsistent work completion, misreading instructions, and frustration. However, it's important to recognize that vision problems and ADHD can coexist. A child may have difficulty focusing due to an underlying vision issue, ADHD, or both. Proper evaluation is crucial to determine if addressing vision challenges can improve attention or if additional support is needed for other attention difficulties. Visual spatial perception helps us understand where objects are in relation to each other and our body. It's essential for reading, writing, movement, and coordination. Children with weak visual spatial skills may struggle with letter reversals, organizing writing, or navigating their environment. Vision provides spatial awareness, while the vestibular system controls balance and posture, keeping the head and eyes stable for reading and writing. Proprioception helps us know where our body parts are without looking, aiding in coordinated movement. When these systems don't work together efficiently, tasks like copying from the board, staying within the lines, or judging distances become difficult. Bilateral integration allows coordination of both sides of the body, which is needed for fluid handwriting and using scissors. Visual perception helps children recognize and interpret what they see, distinguishing letters and organizing text. Weaknesses in these areas can cause difficulties with writing, letter reversals, depth perception, and coordination. The top set of images shows different types of chairs. Despite their differences in shape, color, and style, we recognize them all as chairs. This ability to distinguish similar but different objects is called visual discrimination. In the second set, the chairs are flipped and rotated, but their identity doesn't change. However, letters do have spatial properties. Their position determines their meaning. The bottom row of B, D, P, and Q all have the same basic shape, but their orientation completely changes what they represent. When a child struggles with visual spatial perception, their brain doesn't efficiently process letter orientation, leading to letter reversals, such as confusing B and D or P and Q. Since real world objects don't change based on orientation, children with immature spatial skills may apply that same logic to letters. Fluent reading and strong comprehension require multiple cognitive and visual skills working together. Phonemic awareness allows children to recognize and manipulate sounds in words, forming the foundation for decoding. Ocular motor control ensures smooth, coordinated eye movements for tracking text efficiently. Working memory and attention help retain information while processing meaning, allowing for fluid reading. Visual spatial and visual memory skills enable children to recognize words, track lines of text, and recall what they've read. Language processing and vocabulary contribute to understanding sentence structure and meaning. Sentence construction and cohesion are critical for grasping the relationships between words and ideas in a passage. Finally, fluency ties everything together, enabling reading that is smooth, accurate, and expressive. Weakness in any of these areas can lead to reading difficulties, affecting comprehension and overall academic success. We appreciate you taking the time to learn about how vision impacts learning, attention, and daily activities. Understanding these challenges is the first step in helping your child reach their full potential. Your child's success is our priority, and we look forward to working with you on their journey to stronger, more efficient vision. Thank you for trusting us with their care.